All right, we good. I'll make you host again, and if you can make me co-host.
Yeah.
In case I get dropped. Where are you? Okay.
I am now admitting people. Thank you. All right. To my interpreters, I have made it so that you can pin multiple screens and you are highlighted. So if you would like to pin specific screens.
We tried to work on my microphone. Is this one working any better, Lauren?
Ooh, that sounds much better.
Hello, Lauren.
Hi, Ed. Hi, Leland. I'm sorry that I can't have my camera on. It's drawing too much internet because I'm using my iPad as a camera due to some technical difficulties with my plug and play. So better that you can hear me than nothing at all, though, because I was breaking up in the executive committee meeting.
Oh, okay.
I even brushed my hair and everything today, guys.
Wow,
It figures when there's no camera.
That's the way it goes.
That is the way it goes.
How is everybody?
What's happening, E.T.?
Hey, Happy New Year, everybody.
Same to you, Ed. Happy New Year.
Lauren, you did warn all the new people about me, didn't you, before we had our first meeting?
No, I figure it's best to let people experience you without any warnings or.
You know.
Agreed, Lauren. Agreed.
Lauren sent me a text message a couple weeks ago. She basically said, I've been too quiet, and a quiet Ken upsets her.
It worries me. It doesn't upset me. It does worry me.
It's a scary thing.
Right?
Yes.
I've just been too busy.
Sean,
Yes, ma'am.
while we're waiting, I just wanted to let you know, Lauren knows I need to leave early. So I just wanted to give you the heads up.
Yeah, and this is Karen. If I need to cut out no later than 1:45, we probably will be done by then, but just in case.
We may not be, but it'll be the parliamentarian. Karen, you do what you need to do.
I move we adjourn.
And I will definitely stick around for that. Thank you, Karen.
You.
You know, the worst thing about this COVID is that the lunches that Silk provides are so good and the lunches that DPPI provides are awful. So it really, really bothers me. I'm not going to Richmond anymore.
Well, so we'll get y'all back someday. I really hope very soon because I miss you all. I do.
You.
I don't even know if I know how to get to the road to Richmond.
Gary said you could just, Lauren, Gary said that you could Uber lunches to everyone if you wanted during the meeting.
That would be a really fun experiment in procurement, wouldn't it?
Yeah.
Well, I fixed Brunswick stew for lunch today.
Nice. Or Lauren, do we have, I can't see the folks that are on here. Do we have enough for a quorum? Or it's 7?
You are ready to roll. You have a quorum, and I can do a roll. I can read everybody that's on whenever you would like. Okay.
Let's go ahead and do that. We'll call it to order. It's 11:01 according to my computer. Welcome everyone. And then we have some new members that are joining us, and I'll let Lauren do the roll call.
So we have a lot of support that I'd like to thank. Charlotte Arbogast is with us today from policy. Betsy McElfresh is our DARS communication person who's live streaming this to YouTube. We have real-time captions being provided by iYellow. David McKenzie is our support for video teleconferencing. We have our wonderful interpreters. Ivy Brothers is on screen right now. Liz Leach is our second interpreter. I'm here. Lauren's here. Ed Turner, Ken Jessup, Rob Targos, Sean Utt, Karen Carney, Judy Jackson, Alexis Nichols, Arthretta Martin, Daniel Aranda. I believe that's, yes. Debbie Foltz is on, Gary Talley, Leland Brady, and Maureen Hollowell is also with us.
Good deal. Thank you for everybody that's helping make this meeting happen, and all the interpreting and the closed captioning. And welcome Daniel and Gary. Did you say Arthretta was here?
Yes, Arthretta's on.
And Arthretta, welcome. We hope you all enjoy your time here, and we want you to be active participants. Looking at the agenda that was sent out, were there any changes that we need to make? If not, is there a motion to accept the agenda? Okay, Ed, is there a second?
Second.
Gary, second.
Okay, all in favor say aye. Or do we need to do a roll call?
If you're going to do a motion, we need to do a roll call. If you want to accept it without changes, you don't need a motion.
Well, okay, I'm sorry. Then let's just accept it as presented. Go down to public comment. Do we have any public comment for this, Lauren?
No public comments were received.
Okay. Next item, the minutes. Minutes of the October meeting were emailed out to everyone. Were there any comments, edits, changes that we need to consider? Hearing none, they can stand approved. And we're down to Maureen, Part B report. Are you
All
on
right,
mute?
I had muted myself and I was hitting the button wrong. Hello.
Welcome.
Hi. How is everybody doing?
We're great.
All right.
That was a
Well-
very warm. Okay.
I'm doing wonderful.
I get it. I do. I get it.
Good morning. It's great to be
Hi.
here for asking.
All right. Well,
Hey, boy.
hello. Well, we, as much as everybody else, look forward to getting back into the swing of things and away from all this virtual work eventually, not just for the good lunches, but for other reasons also. So anyways, the SILs all completed their Part B reports and submitted them. And just take a few minutes to highlight a couple of things. A lot of the work that was done this quarter was related to Medicaid because of issues regarding personal care services and other long-term care or home and community-based waiver services. The extensions or exceptions to what is allowed within the Medicaid home and community-based waiver programs have been extended through the middle of March. And so, they were set to expire on January 26th. So it just takes a while for all that information to get floated out to all the people it needs to get floated out to. And the need to make sure that people have what they need while the extension of the exceptions continues to be floated out there. There are things like telehealth meetings, who can provide personal care, things like that. One of the things that we continue to be very frustrated with is the slow pace that DMAS is taking to ensure that people have the equipment they need to do telehealth visits. This has been brought up to their board. It's been brought to them by VASIL and numerous communications. They supposedly have set up a work group, but it's frustrating. People need to be able to do visual telehealth whenever possible, and without having the equipment, that's just not able to occur. And the funds are there through assistive technology as a benefit in the home and community-based waivers, that equipment should be able to be provided relatively quickly. So it's a frustration. There was, in the special session last fall, an award of hazard pay to agency-directed and consumer-directed Medicaid-funded personal care providers, not respite, not companion, just the personal care side. And that was announced in December, or in November, actually in November. And DMAS has started rolling out, or the fiscal agents have started rolling out those payments this week to consumer-directed attendants. And the agency process for getting that hazard pay to the agency attendants, or they call them aides, to the aides, has been slower, and is DMAS expects those payments to be made by the end of the month. The screening process is very concerning for us. We've talked about this before. The law was changed in the 2020 General Assembly to allow screening to be done, screening to determine if somebody is eligible for nursing facility placement, for that screening to be done by the nursing facilities if the hospital doesn't do it as they were required before. We don't have any data on the impact of admissions to nursing facilities, and even if we got that data, I think it's going to be so muddled with the data that is related to people going into nursing facilities after a hospital stay due to COVID, that I don't know if we're ever going to be able to pull out and say what percentage was what, but it's a concern. So the SILs, I've highlighted something in the paper report from each of the Centers for Independent Living. The centers have spent a lot of time doing outreach to those hospital screeners, if the hospitals are still doing screening. It's usually the social work or discharge staff, so that they know that who their Center for Independent Living is in their community. They know who to make a referral to and what they might expect in the way of independent living services if they do make that referral. Really trying to get those hospital discharge workers not to have the default be discharged to a nursing facility, but to have knowledge about community resources like Centers for Independent Living who can help people get the services they need to avoid that placement in a facility. And centers have tried all kinds of creative ways this quarter. It's very difficult to meet with staff because of COVID. People have done things electronically. There's been a lot of mailings and phone calls and outreach, updating who those actual discharge planners are because of changes that are, continually being made. Another big focus, of course, has been trying to stay in contact with the school transition coordinators. As schools have moved more and more to virtual learning, staff who may have solely been designated as transition coordinators at the high school level in the past are being pulled into more instructional type of work. Schools aren't required to have transition coordinators, but over a series of grants that have been awarded since the early 2000s by the federal and state governments, many localities have established positions that are called transition coordinators, or at least staff that have a significant portion of their time spent assisting with the development of transition plans and implementation of those supports. And those are not required positions. And so I think what we've seen is some slipping of those transition coordinators as designated to transitioning into more of an academic and support for virtual learning. And I get that. I think we all understand why some of that's happening, but I think we're going to have to be really careful again to be monitoring that and then advocating as we come out of COVID and go back into a different learning environment that those positions come back into being. They're not required positions. They're positions that may have been established with a grant over many years. And of course, when the grant went away, the local school division kept those positions in some situations. And we just want to be sure we don't lose those positions. So that kind of takes us through the report itself. Lauren, I don't know if there's something else you would like me to add to the report at this time.
I don't have anything. I'll direct that back to the chair, Sean, and the council.
Does anybody on council have any questions for Maureen or?
I have one question, just as far as the frustration between telehealth and DMAS. Can you, because I missed some of that, can you just explain some of the frustration between telehealth and DMAS?
Sure. When the pandemic began in March of last year, or at least recognized by government that it was begun, Medicaid at the federal level allowed states to implement a very broad telehealth approach to providing services. Traditionally, telehealth has been pretty restricted in how it can be provided, who can receive it, and for what kind of services it can be received. So for example, in Virginia, when they wanted to expand telehealth for some mental health services that Medicaid provides, that had to go through the General Assembly, and a tremendous amount of policy and regulation was put around how it could be provided. So for example, if an individual needed, and I'm making up the geographical areas here, I'm just, for example, if an individual in Wythe County needed a mental health services through Medicaid, and there was no local mental health counselor to provide that service, that individual with a disability who needed that service would be able to go to the office a local medical office that had telehealth equipment, had a computer with a visual and verbal representation of that visit. And the person with the disability would just travel to that local Department of Health office or Department or Community Service Board office, and they would sit there and have the telehealth visit, maybe with a counselor who was sitting in Charlottesville. And through that very limited process, telehealth was able to be paid for in certain circumstances for certain people through Medicaid. So it was very tightly regulated. And that was to avoid all kinds of problems with who had access to what equipment, abuse and fraud, things like that. But when the pandemic began, at the federal level, they loosened up all those requirements and basically said, you can do telehealth of all these kinds of things, many services, immediately. And you just had to do these couple of things, but you could do telehealth. And on top of that, your telehealth could be done just by phone. You wouldn't even have to have a video, you wouldn't have to have a visual representation of the person providing the service and the person receiving the service. Right. And that allowed physicians to do all kinds of things for providers of all kinds. The problem that has come in with this is that in many instances, the telehealth that has been provided has just been phone. It's not been any visual representation. And so that was supposed to end March or January 26th. The allowance that the federal government gave to states that requested it, and Virginia requested it, to do that broad telehealth was supposed to end March 26th. That has been extended now.
Main menu. If you want your messages now, press 1. Send a voice message.
That extended until March now.
Press 3. For additional options, press 0.
Maureen, I'm trying to mute the sound that you're hearing. I apologize. I'm trying to isolate.
I think it's me, and I'm trying to do it too.
Can you press *6 if you're on your phone or
I can't find the mute.
It should be on your Zoom bar.
There we go.
Thank you. And so it's been a good option for many people with disabilities for a long period of time, since March now. But the concern is that there's no visual representation. Many people who receive Medicaid services don't have computers with cameras, or they don't have smartphones with cameras. And so they don't have the benefit of doing a visual appointment or meeting. And so Medicaid, through home and community-based waivers, offers assistive technology. And that assistive technology benefit could pay for somebody to have a tablet, a smartphone, a laptop, or whatever is appropriate in that situation. And the process of getting those requires the individual to get a prescription from their physician, to get a evaluation from a therapist showing what is needed, to go to certain providers. I mean, it takes months to get that. And many of those providers aren't even available because of the pandemic. So what they still had requested back in the late spring is that there just be an exception, like there is for many other things, that some of those requirements that are a roadblock to getting that assistive technology right now be set aside. And it was a reasonable request, not only because it came from us, but it was a reasonable request because DMAS had allowed an exception for durable medical equipment. I don't know, bath chairs, G-tubes, I mean, all kinds of things. They allowed all kinds of exceptions for those providers to get their DME, to set aside some of those requirements. And all we were asking is to do the same for people so that they could telehealth. And there has been, DMAS is overwhelmed with other things and it was not prioritized. And so we keep pushing the issue, and I believe after the last board meeting, it is now prioritized. But that's the issue. So telehealth is important. People with disabilities who can't afford this fancy equipment shouldn't be shortchanged on their telehealth abilities. And DMAS has a way to make it quicker for people to get this equipment, and we want them to do so.
Thank you for the clarification. I appreciate it.
Yeah.
Maureen, this is Karen. The AT benefit would not actually pay for internet access, though, correct?
You're right, Karen. There are many areas of the state that don't have internet access, which is just amazing and being worked on, but not fast enough. And there are people who can't afford the access, even if there is access. And so there are ways to work around that, either by including a year's worth of what is the little box you get so that you can get internet in your house if you don't have internet? Thank you.
Wi-Fi, yeah.
Thank you. Hotspot. There are ways to include that for a year in somebody's assistive technology request. And there are other ways that this can be done that are more cumbersome than that. We would hope that's the option they would go for. But for individuals who live in a physical area that does not have internet access, or the internet access is too slow to be anything but frustrating, there's no resolution for that yet. That's where the state just has to get in there and use a lot of money that's been allocated to it, but it's not happening fast enough to get high-speed internet to parts of the state that don't yet have it.
Thank you.
Any other questions for Maureen? Well, as always, thank you, Maureen, for the report and for all the work you guys do.
Thanks, Sean. Bye.
See you.
Thank you, Maureen.
Thank you, Maureen.
Okay, next one down, Disability Resource Center. Do we have Deb and Amitri?
Debbie, you're on mute.
I'm on mute. I know, I'm on mute. Hi, good morning. We're happy to be here. And so I just wanted to give you a little bit of background and then introduce you to Dimitri. We have had successes and not so successful opportunities in PD9. And so when the end of the last grant came due, we were considering how we could do this better. And an opportunity came up through some friends of mine at Goodwill, where Amitri is a full-time employee, but because of COVID and some other things, they didn't really have full-time work for her, and were willing to do a contract with us. So she's still their full-time employee with those benefits. So that was November 1st, so we already missed 1 month of the quarter. Cheryl, although, she lives in the area and she's doing a good job, she had too many commitments with her family, so she had resigned in October. And so, unfortunately, Dimitri had to go out on some medical leave, so she missed a couple more weeks. So the first quarter, although she did a lot, she's ready to get going a little bit more. And so she came over to Fredericksburg last week and we had a really good meeting looking at, I know that you've seen our grant proposal, the things that we said we were going to do in the timeline. And so we adjusted a little bit of the timeline just because we're behind a few weeks. But she's expanding and confirming the contact list that we have for agencies and nonprofits and businesses and churches and civic organizations. And then she's making individual connections with pertinent people in the area to see if we, to develop this advisory group. I clarified that DRC never was planning on expanding our reach, where our total goal is to assist that community group over there, expand that group over there and get them having their own satellite and cell in the future. So I think that was maybe a little point of confusion to begin with. It's not going to be DRC getting bigger. We're happy the way we are. We have changed some of our services over there. I mean, for a long time, I did the benefits planning in that area. And then we no longer, have that grant, of course. And then last year, the Deaf and Hard of Hearing decided that they were going to serve that area out of Richmond rather than have us do the TAP loan program, which is unfortunate because we still continue to get calls from people there that aren't able to get services. And so we're able to serve folks out of Fredericksburg for that, getting equipment when they can't get it any other way, and some things like that we've done. And I don't think I included that in Amitri's report. There was one family that was in particular need, and so it was just easier for us to go ahead and buy the piece of equipment for them to get services. And so, Amitri, I'll let you talk about your background a little bit and what you've been doing for the past 20 years and how, this is a match made in heaven as far as I'm concerned. I think that the perfect person living in the community and having experience is going to help us.
Sure. Can everybody hear me?
Yes.
Yes.
Okay, great. I have lived in PD9 since 1994 in the lower area of PD9, off and on since 2002. I have lived experience as a person with disability due to a unique brain aneurysm that ended up in needing to have open brain surgery that resulted in 2 significant strokes and epilepsy and a variety of other impacts from that surgery that left me actually without the ability to walk independently. I had outstanding support from the community here in Culpeper, along with family that came in and out of the community. It took me 9 years to walk independently using a walker that I still need from time to time, but not as much. There's still issues with speech at times and definitely memory and other issues that still come along from the original brain injury. I'm able to drive due to work with an outstanding neurologist. But, there are still issues with that. It's well managed. But I definitely understand. I use the Center for Independent Living on this journey, the one in Manassas. So that was part of my journey. So I definitely was excited to come on board with this project here because at one point I called Culpeper the black hole of services for people with disabilities. When I could not drive, I was lucky enough to have a family that could assist me. My parents were able to come in and out of the community. And when they weren't here, they were able to pay for a driver, but not everybody has those resources. So this was really important to me. If you looked at my report, part of what I did at one point when I was a little baffled getting started was I called together a group that I'm a part of that does what we call intentional conversations and asked them about what I thought. And I'll be honest, they didn't get it. And so then I went to April online to try to understand creating a Center for Independent Living in rural areas. And I've really struggled with that a little bit as we're starting to do this project. And it's one of the things as I'm reaching out to the different groups here that we're wrestling with. Is the issue of starting a CIL in a rural community. It presents unique challenges, different even from our parenting group in Fredericksburg. It's not the same, but it's not impossible to do. So that's why the outreach to these groups has been really wonderful, especially in the last even week or so. People are starting to get it, but the most important piece is reaching people like me, people with disabilities. They have to be the foundation of the SIL. What they want, what we need, is so critical to this. So yes, I have an interesting background. Along the way, I've been the attorney for a public school division. I've been an assistant county attorney. So I've worked with adult protective services. I am the deacon at an Episcopal church. So I've done pastoral care along the way. And I still continue to do that. I still hold an active license with the Virginia Bar, which has been a struggle as a person with disabilities. I am still sitting right now in a Virginia Career Work Center. So I do see from time to time people coming in who want work, but as we often see, they're coming in with what I call a supporter, or which often is referred to a caregiver who is speaking for them or is telling me what they need, or who has made the first phone, which is to me often very frustrating. And they're resistant to putting the person who allegedly wants that service on the phone. So that's a little bit about me, but I'm really here for you all to ask me questions and to tell me what you're thinking.
Welcome, Amitri. This is Sean, and I just want to say that I've never heard, or what's the black hole of services is pretty deep to me, because I've kind of lived some of that in the New River Valley, and we don't have it as much here in Smith County, but hopefully you'll be able to break through that, and hopefully we'll be able to be a good partner with you to make that happen. Are there any questions for Amitri?
I have a comment. This is Alexis. Amitri,
Okay.
I just wanted to thank you for sharing your story. Thank you for saying that people with disabilities need to be at the forefront of everything that we do and the services that we receive. I think that's a message that it's often forgotten. You know, it's more so out there now, but I just appreciate you for sharing your story and getting that message out there.
Agreed. Anybody else for some questions, comments for Amitri?
Dimitri, I just want to piggyback off of what Alexis said, and thank you for everything that you shared and for your wide range of experience, from being a lawyer to being a pastor and doing the different experiences that you have done. One question that I did have is, you mentioned about having an issue starting the SIL and working with the parent groups to try to set it up. Can you either give more information or give us some of the issues or barriers that you've encountered?
Oh no, that's me not being clear.
Okay.
I haven't even gotten to parent groups yet. I have no problem working with parent groups because I am the parent of an ADD who was an ADD child.
Okay.
And another child with another disability, but because she is an adult and a professional, I won't share that. No problem with working with parent groups. What I was talking about is here at the Workforce Center, often we will have parents of adults even call in to ask for a service. And I'll say, oh, can I speak to that person? They'll say, oh, no.
So that goes
for them.
Right. Okay, so that goes back to what you said before about the supporter, the caregiver speaking for the person. Okay, I misunderstood. Thank you for the clarification.
Thank you for the question. That's a real important difference.
So one of the things that we talked about are the resources that we have at DRC that we can share with the Culpeper and Lower PD9 community. And the SILs, the other SILs in Virginia too, are also doing, you know, videos that are online and available to people. But as we get back into doing face-to-face things, we had done face-to-face trainings in Culpeper. So our Medicaid mentor that works with Maureen would go over and do a presentation. And Dimitri has lots of ideas about community locations that maybe we can get a bigger draw of folks. The only one that we really had a lot of people was when Kim Lett did something on autism. And most of them were professionals, not families or people with autism. So we hope to get some feedback from surveying people to what type of workshops and training they would like, and then help Dimitri do that with either our resources or people that we know that facilitate those kind of groups. But she's also been doing a little bit of one-to-one, helping people individually. And so I think that location that has a storefront, well, where people can come into the Goodwill building every day is a great thing, because oftentimes she can, you know, they don't come in to see her, but she ends up getting a referral from another staff member. So lots of resources from.
This is Lauren. Vasantha Raymond member has raised her hand. She has a question, so I'd like to turn it to her.
Hi, I am Vasantha, and this question for Dimitri. How would job coaches be aware of the situation that they need to give the client who is disabled? Like when I heard your story, my son is in similar situation, he's 30 years old. Because of the virus situation, he is not going into the job coaching for a while. And the job coaches try to take over and do everything. Like you mentioned, like the parents speaking on behalf of the clients. So he had a brain injury, and also he is in the epileptic population. So it's a similar situation, but he's very able to do his job. And when everything comes back to normal, how do we kind of educate the job coaches that they need to give more freedom for the clients to speak up? Thank you.
You know, that is one of the things we have here in our center, and Lauren can give you my contact information. I can talk to you more about this. So we have some grant programs here that work with people who are in the workplace or wanting training that help educate even job coaches about things like brain injury and epilepsy. People just don't know that even though you have a brain injury, I used to call it brain injured or brain damaged, but not brain dead. Because people used to think because I had a brain injury, I couldn't function. And I could, but it was taking me time to before I could talk, people would talk for me. Or because I had epilepsy, they assumed my brain didn't work. And so I needed people who knew more than the job coach to educate the job coach. And there's services out there that do that. There are web resources that do that. But the job coach didn't know to go to those places to learn. And so that's where places like DRC come in to help advocate for the client, to explain to the job coach, slow down and give the client time to articulate and to say what job coaching they needed. I needed someone to tell my original job coach, this is what she needs and this is what she doesn't need. Because sometimes the job coach is not helping, they're slowing down progress. And that's where advocacy comes in. And so I needed like an advocate with my coach so I could make progress.
It sounds like there's just based on what you said, it's somewhere at the intersection of self-awareness for the job coach or for professionals, and some sort of understanding or just bias that they're not aware of, and just navigating through that, or even people understanding the space in that area. Would that be accurate?
I think it's actually, and we've encountered this with the Workforce Center, it's actually old knowledge.
Okay, so
unfortunately, people in like job coaching are working off of like 1960s, 70s knowledge of health. And what we do here in the workforce centers is try to update their knowledge of disability. Mm-hmm. And that's one of the things I'm really lucky to do in my other work, is to update their knowledge of this is how, like, brain injury, and it's like Google, like use your Google. You can Google these things like on Jan, you know, and just learn. And except, you know, everybody's busy, everybody takes shortcuts, except this is critical information for people who do job coaching. And it's not a good place to take shortcuts. And so that's one of the things the workforce centers can help people with. But, and again, that's where let me slow down. The SILs and can work with other partners in the communities to assist people with disabilities in accomplishing their goals.
Thank you for
that. I'm not speaking for the silk, but for me, I think that's exactly what we were hoping to get for the lower PD9, and thank you for. Sounds like you've got plenty of energy to make it happen. So, anything else, Dimitri or Debbie?
No, thanks for letting us come on today, and feel free to, in between times, ask questions or comments, or if you have ideas for us, we're open.
Thank you. Thank you.
Thank you for joining us.
Thank you.
Looking at the next item, executive committee report. We did have executive committee meeting earlier this morning, and went through the normal items, the treasurer's report, which you'll hear from in a minute, and kind of a brief synopsis of the lower PD9, how we're able to get that going. In the conversation during the treasurer's report, well, do you want to do that as Ken, do you want to, can we skip my report and go to the treasurer's report and then come back to the recommendation from the executive committee for the treasurer's report?
Sure.
Yeah.
Let's do that. Ken, why don't you go ahead and do your treasurer's report, and I'll take a step back to the executive committee.
Okay, that sounds good. Well, first of all, though, I want to, if Maureen is still here, I want to apologize to her for the phone. My house phone was going off at the same time she was giving her report, and I had to go capture the house phone and shut it down. And also, for those of you who don't know, if you hear loud noises, it's airplanes flying over. I live right at the end of a runway. So I just want to let y'all know if it gets too noisy, I can mute myself. Okay, the treasurer's report. The fiscal year for 2020, total Part B award amount was about $3,769 more than the normal. It was $467,600. There was an increase, a slight increase. The Silk has received $90,878 for 2021 level funding, or very close to level funding. Level funding is expected, but so far we don't know. Note that the carryover amount, as is the unbudgeted amount in line 23, is $63,666. And I think that's where Sean wants to have a discussion. As long as meetings are virtual, there will be operations, there will be, hold on. There will continue to be less expenses for council operations. The expenses that are incurred for virtual meetings include ASL interpreters, real-time captioning, and sometimes lunch. There we go again. The first quarter Part B grant award payment to centers and Vasil has been paid. Conferences are expected to continue, although they'll be virtual through the year, though nothing is really certain. And finally, the council may want to consider allowing SIL directors to attend conferences using a portion of the conference funds for those events that are virtual. Thank you.
Any questions from Ken, for Ken? Okay, hearing none. Let's, if we can go back to the executive committee report really briefly. The only action or recommendation that we have coming out of the executive report was dealing with that $63,666. That is a pretty good buffer. And thinking about the resource development budget that savings that we're going to likely have this fiscal year, we want to make a recommendation that we take that $63,666 and provide a grant somehow, some way to VASIL to be able to spread out to the 17 SILs, mostly in an effort to help them meet their consumer needs. There's a lot of consumers out there that have needs around the pandemic that aren't there, that we have no other resources, or the SILs have no other resources to help with, and we want to we recommend that VASIL be a partner in helping that happen. Any questions or thoughts or comments on doing that?
Sean, this is Lauren. I just want to interject that this would be done if and when the council receives their full FY21 award.
Correct. I'm sorry. Thank you for.
No problem.
So that would be right now as a form of a motion from the committee. Are there any other comments or questions? Yeah, so go ahead, Ed.
I think it would be a pretty good use of those words, because the series have so many participants with these. I would support that recommendation.
Ed, do you mind if I repeat what you said for
Please,
everyone?
Lord, please.
Ed said that he thinks that this is a very good use of funds because there are so many needs coming from the sills and that he would support this. Is that correct?
Very good job. Good job.
Any other thoughts or comments? I guess since it's a recommendation from the committee, we can go ahead and do the roll call vote, Lauren.
Yes. If you'll just unmute yourself when I do say your name. Daniel Arenda,
Here?
is it yes to the recommendation?
I'm sorry. Yes.
You're fine, no problem. Thank you. Leland Brady. I'll come back up to Leland. Arthuretta Holmes Martin.
Yes, I'm here.
Is this a yes to the recommendation?
Yes.
Thank you. Ken Jessup,
Yes.
Karen Carney,
Yes.
Alexis Nichols,
Yes.
Vasantha Raymond,
Yes, and yes, please.
Gary Talley,
Yes.
Rob Targos,
Yes.
Ed Turner.
Yes.
All right, and Sean, why don't you wrap it up in a nice neat bow before I go back up to Leland?
Yes.
Leland? She may be away from the, oh, I'm sorry, I didn't mean to interrupt.
No, can you hear me now? Because
I can hear you.
Okay, yes to the recommendation.
Thank you so much. All right, that is unanimous. Thank you.
That is that's the report from the executive committee. So any questions from that? If not, I will turn it over to Ms. Carney and Mr. Targos to discuss the nominating committee recommendations.
All right. Well, Rob and I were tasked with recommending officers for the next year. We have a slate of officers that we would like to recommend, and that would be for myself to move up to chair, Ken Jessup to move up to vice chair, Rob to move into the treasurer's position, and Leland to become the secretary. We have spoken with everybody. Everybody is has agreed to serve. So that is the recommendation. Sean?
Thank you, Ben. So we have a slate of officers. Some many boards do this differently. Are there any other recommendations from the floor? Hearing none, then there's as recommendation from the nominating committee. Can we go through the same roll call to accept those recommendations?
Yes, I will do another roll call. Remember, it's a yes or a no, agreeing or not agreeing with the recommendation. Daniel Arenda,
Yes.
Leland Brady,
Yes.
Arthuretta Holmes Martin,
Yes.
Ken Jessup,
Yes.
Karen Carney,
Yes.
Alexis Nichols,
Yes.
Gary Talley.
Yes.
I skipped over Vasantha Raymond.
Yes.
Thank you. Rob Targos,
Yes.
Ed Turner,
Yes.
Sean Utt.
Yes.
Thank you. That is also unanimous.
Thank you. Congratulations to those folks. I'm assuming, would they take over effective the next meeting or effective tomorrow or right now?
I think that a next meeting would be ideal. that gives time to give support to the oncoming new member, Leland. I don't think she'll need much, but.
Okay. Good
So
deal.
next meeting is your new officers will be presiding.
All right. Next item on the agenda, we have our SILK program performance report, formerly known as your 704 report update. Lauren?
Sure. So I briefed the executive committee on this morning, and every year your annual program performance report, the PPR, I will probably call it the 704. They are the same thing. Do not let me confuse you. Every year that is due normally on December 31st, no later than. However, this year the reporting tool was removed due to numerous problems by ACL. ACL has not yet put into place their new reporting tool. So I do have a draft of the PPR that is nearly 100% complete. There's one little piece missing that should be done within either this week or next week. And it will be filed away, and then ACL will let us know when they've got that new reporting tool up and online, and I will input the report at that time. And as you know, ACL can always come back with the wanting clarification or asking for more information. So I will continue to keep you apprised of anything developing from this.
And Karen expressed this morning too that I guess a lot of the SEALs are having the same issue.
Yes, normally the Part C centers, those centers that receive Part C funds, the 6, they also have to fill out a 704 PPR and submit it directly to ACL. And the SILK, this is for new members mostly, I think, and it's a good reminder. The SILK PPR actually includes all of the centers that do not receive Part C funding. So those are your state funded centers. Those reports are as neatly and cohesively as I can possibly do, combined and included. That information is included in what the SILK reports. That way ACL gets an overview of the entire network.
Sean, excuse me. I just got a text message from Jerry and Lauren. He wanted you to know that he is on the phone, but he is muted.
Oh, Jerry, thank you. Okay, let me
Welcome,
go through. All right, I've made that note. Thank you.
Anything else on the PPR?
I don't have anything. If you have questions, I'm happy to answer anything.
Any questions? Okay, I'm looking at the what you have on the screen. We are way before 12:40, so let's go with agenda item number 10, special reports. Marcia, are you still with us?
I am still here. Can everybody hear me?
Yes.
All right. Well, I guess it's almost afternoon, but I can still say good morning for one more minute. Hello, everybody. And I'm delighted to be able to give the DARS update, though it should be fairly brief. I'll start out just by talking about the vaccine a little bit. Many disability advocates and advocate groups were able to weigh in on, give their voice about their concerns and thoughts about the vaccine to the Department of Health. DARS has been in communication with the Department of Health for some time, making sure that their representatives know how to be in contact with the SILs and other disability providers about the vaccine distribution, as well as advocating for getting those groups in 1A, and if not 1A and 1B, in those categories. And what we're hearing back is that there's been, varied success, that it's really really varied from agency to agency and from local departments of health in different communities. And part of that may be based upon the nature of the work that a given agency or a given staff person may be doing. But in any event, we would encourage you all to maintain close contact with your local departments of health as this rollout continues. But we have been engaging in ongoing communication with the Department of Health to try to ensure that there's good communication there, and that people with disabilities are included in those higher priorities in those earlier categories. So also just wanted to talk a little bit about budgets. For the most part, most of the programs within DARS are receiving level funding. We did, of course, there has been that smaller relief package that was passed late in December. While we haven't received those funds yet, we do know that that they will be much less than the earlier relief packages, and that that the individual packages, there were some small funds that we expect for the meals programs for the area agencies on aging, nutrition programs, and some of the elder justice programs. One item of note, for the first time, Adult Protective Services will receive targeted funds, federal funds, and so that's something new and different. We're pleased about that. There are a number of general provisions in this relief package that will impact people with disabilities. There is a 15% increase in SNAP benefits. There will be a 25 billion, and these are national figures, so don't have the amounts that Virginia will receive yet. 25 billion for emergency rental assistance. I know Maureen spoke about a number of these items earlier, or at least indirectly. There will be an extension on the moratorium for evictions until January 31st. And then there'll be a creation of a new program that provides $50 in monthly credits for broadband. And that's specific to individuals that meet criteria such as being below 133% of the federal poverty level, receiving Medicaid, SNAP, that kind of thing. There's also another effort related to broadband, $1 billion for new grant program that's intended to increase broadband access for areas that don't have it. And so those are just some of the items that are in there that are general provisions that certainly will have an impact on folks that we serve. So just wanted to highlight those for you. As Maureen highlighted, Centers for Independent Living continue to do exceptional work in serving folks during the pandemic. And there's nothing really that I can add to her report. So we certainly applaud their efforts. We are working on a couple of grants right now, and we hope that ACL will have more grants that we or the SILs can respond to. Right now, we're working on a falls prevention grant and also a lifespan respite grant that we can continue to offer some more services to folks. Another item that's happening today, our No Wrong Door program is being highlighted nationally today. The U.S. Department of Health and Human Services and the Administration for Community Living created a challenge opportunity called the Mobilizing and Empowering the National and Technology to Address Loneliness and Social Isolation, called Mental Health Innovation Prize Challenge a number of months ago. And there was a lot of national competition for that. And we learned, we received the one of the prizes for an earlier round several months ago. And it will be announced today that the No Wrong Door Virginia team is one of the 2 finalists. And that will be announced at the Annual Consumer Technology Association trade show. So we're super excited about that. The No Wrong Door team is going to showcase their winning social health connector at the trade show. And what that program will do is it will allow visitors to engage in a social connections platform that will allow them to interact and connect with users. Visitors can browse available resources, complete a short comprehensive assessment of their social health, receive personalized answers, options, and resources based on their individual responses and preferences. The individual can then create their own social connection plan, and then visitors have the option to enroll in programs directly from the site, and the consumer reviews of resources are incorporated. The project builds upon several existing resources, including No Wrong Door Virginia, Virginia Navigator, Elder Care Locator, and 211. And in addition to the announcement today, No Wrong Door Virginia will also play a key role in piloting and the launch of this national campaign, an initiative to combat social isolation. And specifically, they will work alongside with United Way worldwide and 211 nationally, and will be engaged in the National Commit to Connect campaign with AARP Foundation's role as the coordinating center supporting the initiative. So that's pretty cool, and we're very excited about that. So those are my updates, and I'd be happy to answer any questions from anyone.
Thank you, Marcia. Anybody have any questions for Marcia?
Looks like Karen has her hands raised.
Yeah, or are you just clapping?
I was just clapping.
Oh.
I'll clap my hands.
Great.
So Marcia, I have a very good report. Thank you so much. And I have a couple of questions just for clarification. You mentioned about the vaccine, 1A and 1B. Is that just the different groups, or does that refer to anything specifically with the vaccine? That's question number 1.
Okay. Do you want me to answer question number 1, or you got more?
I have more, but if you can answer that question first, and then I'll move on to the next one.
That refers to, I didn't want to try to go into details off of the Virginia Department of Health's plan, but right now, the Virginia Department of Health has priorities listed on their website, 1A, 1B, and 1C. And then they have the specific designations under those priorities of who is included under each of those.
Right. So that's just a level of priority with the vaccine. Okay.
Yes.
The other question that I have is with the targeted funding that you mentioned. I missed what you said on who or what was being done with those targeted funds.
That funding refers to the most recent COVID relief package that was passed in right around the holidays, which we actually haven't received yet. So I was just pulling out a few bullets of various groups that were targeted with that funding. And because Virginia hasn't received their allocations yet, I was quoting some, if I quoted figures at all, I was quoting national figures because I don't have the amounts that Virginia would receive yet.
Okay. That's all. Thank you so much, especially with all the information regarding No Wrong Door. That's really exciting.
Any other questions for Marcia? Thank you, Marcia.
Thank you.
Moving to Eric.
Can you see me okay?
Yes.
Well, first of all, this is Eric, and I'd like to say Happy New Year. I hope you all had wonderful holidays, and I'm hoping that we could already jump to 2022, don't you? So you probably already know that our offices continue to be closed. We have limited services as far as seeing consumers by appointment only. And that's mostly related to equipment distribution and interpreter performance testing for interpreters taking a performance exam. But we do continue to provide relay services and interpreting services. Most of the interpreting services are provided virtually at this point. One thing I will share with you is that our community services manager, a woman by the name of Karen Brim, she is wearing two hats currently. She is working as the community service manager for VDDHH, and she's also serving as an access and functional needs officer for a short time. Of course, that's been going on since COVID started. So she's been doing both activities. So she represents people with disabilities, people who have limited English proficiency, and other vulnerable populations. Talking about access needs for those access for those specific groups, especially in light of the coronavirus. She's talking to them about communication for people who are seeking tests and vaccinations and so forth. Right now, we've been hosting every 2 weeks meetings with different organizations to represent people with disabilities, talking about access and functional needs for them in relation to the coronavirus and pandemic. She's also a member of the Virginia Department of Health's Office of Diversity and Inclusion, and recently got an award from the governor's office for her efforts in that regard during the pandemic. So we're very proud of Karen, and she's been playing a major role on that team. A few other things to mention that have impacted us. Remember, I think I shared with you all that we are working on a deafblind pilot project, a support service provider project. And unfortunately, because it requires face-to-face and fairly close interaction with people who are deaf and blind and tactile signing, that is not going to fly during the pandemic. So because of that, the funding from the Department of BBPD, we asked them to postpone that so that we can host, so we can do that pilot program, not this year, obviously, but hopefully next year. So we've asked them for a second extension because we are still not in a safe place to be socially closer to people at this time. So we do hope that 2022 will be the year for us to do that pilot project. And again, just to say that's on hold for now. We are hopeful that things will work out in January of 2022 for us to move forward. Currently, we know there is a the General Assembly is in session. They have their meetings are being held virtually currently, and that's a challenge for providing as far as captioning and interpreting services for them. We are monitoring now to see how we can provide increased access for people who are deaf and hard of hearing. EDDHH's budget is pretty much the same. We have had some change in our federal and special funds. And so we are making some tweaks in our budget to address that. But everything currently is fairly level. So that's pretty good considering what we've all been through this last year of 2020. And that's all I have to report today.
Thank you, Eric. Any questions for Eric?
Active messages. 100 message.
Is that you?
I think that that's background noise.
084.
Wasn't me this time.
This is Debbie. I have a question. If I can I ask a question?
Or why not, Debbie? Go ahead.
Okay. I just wanted to ask Eric about the rules and the guidelines that are in place for equipment distribution. Is there any way for those to be somewhat changed or have waivers for some of those for right now? The situation that we entailed was a 96-year-old lady that didn't have a photo ID. And so she wasn't able to get what she needed because of that. And, you know, you can't go to DMV without an appointment, and then that's not even good. So in that case, she was denied getting equipment. So I'm wondering, is there any flexibility during COVID?
This is Eric speaking. Unfortunately, no. The rules are in place and we don't have any exception to that at this point. But if you don't mind, maybe reach out to me and give me a little bit more detail about that woman. I'd be happy to follow up with my staff on it.
Okay, sure, thank you.
Eric, I had a question just regarding the General Assembly, and with the fact that it's now more difficult with the virtual meetings, is the General Assembly submitting any informational reports to make it easier so that things can be captioned before the meeting or during the meeting, so that it I'm just curious about that.
Well, right now we are working with the House and Senate clerks And I'm not sure if they are captioning all of their hearings at this time. I think mostly it's that we are just looking for any bills that impact the deaf and hard of hearing community. That's what we are tracking, and that's what we are looking to provide captioning for, those types of committee hearings, not for all of the meetings.
Okay. Is there any follow up on that? Is there any requirement, since it is particularly for the deaf and hard of hearing, is there any requirement for the bills themselves to be captioned or submitted beforehand so that people can review them or follow along with them?
Well, just to clarify something, when I say bills, I'm talking about bills that will impact the deaf and hard of hearing committee. They might not be available ahead of time to be read, but also committee hearings where they are discussing those bills, those should be captioned. Right now, we have a federal ADA requirement, requires that state will provide access to that. Unfortunately, not all of the state is accessible. So I think we're pretty good with providing, we've been pretty good with providing interpreters when they make that request ahead of time. And that can be a challenge because sometimes things come up last minute. Right now, we have a special contract. It's with Purple Communications, and they have it understanding and working that out with them to provide access with Purple Communications. Yesterday, the governor's, his speech last night, the State of the Commonwealth address was captioned, and we did have an interpreter there. As far as that was just for the governor, but going forward, we're still going to be monitoring. And again, this just came up, of course, yesterday, but we'll be monitoring anything as it goes forward.
Maureen, did you have something that you wanted to add? I saw your hand pop up.
Thank you. Sean, if I could just expand on that a little bit.
Please.
Thank you. First, you know, there was a special session this summer and fall, and that gave the clerks of the committees an opportunity to figure out how all this virtual meeting stuff could be made accessible. And they had some real challenges and bumps in the road, and VASIL worked with them throughout the special session. An example would be some of their, when you participate, you watch a meeting or you participate as doing public comment, that session of the meeting is done through Zoom. And so they take their typical, if we weren't doing virtual meetings, screen, like a TV screen that when you would normally watch when you watch the session from your office or your home, and they overlay that with a Zoom screen. And when they overlaid that with the Zoom screen, the captions disappeared. And that kept happening throughout the special session. And we eventually had to just set up a meeting, physically go there and show them what was happening, because they weren't, it was hard for them to see what they were doing. So we have noticed yesterday and today that seems to have stuck, the fix. So bills are one thing. Bills are posted before they're discussed in a meeting. You're not going to see a bill not available online before a meeting. So I think that's a really good question that somebody was asking about, are bills, how are bills posted, and, you know, are they posted? Absolutely, they're posted. There should not be legislation moved forward in a committee without you being able to access a copy of that bill through the legislative system just like in previous years. You can still do that. As far as committees, it's been interesting. You know, they are still trying to adjust the sessions, like, you know, when everybody goes, the Senate goes into session and the House goes into session, typically at 12 noon. Those are captioned. You know, that's work Vasil did 10 years ago to make those sessions captioned. We've had problems in previous years where there have been problems with the quality of the caption. We've had, you know, one session so far this year. They're in session right now. I don't know what the quality is, but during the session, that seems to be okay. When the House is there and the Senate is, well, the House is, you know, virtual. The Senate is over at the museum. But then committee is the real challenge, because committee is where you are given the opportunity to do public comment. Those are captioned. And so you're going to be able to follow along. You don't have to make a request. Those are captioned. But as Eric was saying, you do have to make a request for sign language interpreting for those committees. But it is provided, just like, you know, he said it would be. Now, we don't have a lot of experience yet this year. They just started yesterday with subcommittees. And in the past, subcommittees have been very important to people with disabilities, because that's usually where you can go and be heard the most. You have the most time to talk. You have your best chance of trying to change something that is going one way or the other, or to be supportive of something. For those subcommittees, you may have to request either interpreting or captioning, depending on what you need. Last year, we did not see consistent captioning or live, you know, showing on the video so you could watch from home the subcommittee meetings. But since all subcommittee meetings are now virtual, as advocates, our belief that would be that just as all committee and session meetings are captioned, all subcommittee meetings are going to need to be captioned, since they're virtual now too. Clearly they should be. Whether they have been or not, I don't know. Subcommittees are just getting started today. So now, granted, somebody may want an interpreter and not captioning of a subcommittee meeting. For sure, they're going to have to request the interpreting. That's no doubt about that. But hopefully they've got the subcommittee automatically being captioned, but we don't have any history yet to know that that's happened. So those were really good questions, because it does make a big difference with all this virtual stuff this year, and how people are going to be able to access what they want to access.
Thank you, Maureen.
Eric, I wanted to add, thank you, Maureen, for that expansion and explanation. And also, I realized that, you know, people who are blind, disabled, they don't always have access to websites. So that can be a challenge as well. It's not only the deaf and hard of hearing, but the blind community too has trouble with accessing the information. You know, all disabled people should be able to access their legislature, their representatives.
Any other questions for Eric?
I just want to thank Maureen for the extensive explanation. That was really helpful. And thank you, Eric.
No problem.
Okay. Yeah. Let's go ahead. Judy, Department of Blind
Yes.
Vision.
Can you hear me?
Yes.
Yes. Okay, good. Thank you so much. I am really enjoying being part of this council. I'm learning so much. And as you know from the executive council or executive meeting this morning, my noviceness here on this, but I'm learning. So it's been great. I want to start out my report, first of all, by giving a shout out to the people at No Wrong Door. I have had the distinct pleasure, privilege, and honor, and whatever other great adjectives you want to add, to work with them. I have to say that they are a committed group of people. So Marcia, I was so excited to hear of their getting to showcase their stuff. But one of the things that they have done, along with working with Virginia Navigator, is to make a website that allows individuals with disabilities and otherwise to go in, and if they're looking for housing, if they're looking for food delivery, whatever the case might be, but they've developed this website. And one of the things that was extremely important to No Wrong Door was that website be accessible to those of us who are blind or who have low vision. And they have been extremely committed. We've met 2 or 3 times, and I think are going to meet again. And they are so good. They were able to make changes on the fly as I was looking at the website. Now, I will admit they dug to at the bottom of the dregs when they asked me to help them. But I'm thankful to say that we were able to make some good changes. Their website was already good. I certainly don't want to leave anybody with the impression that it wasn't good at all. But so we tweaked it, and it's really usable. And so I just really, really thank those folks at No Wrong Door for being so committed. That's been great. In terms of DBBI, as many of you know, the positivity rates have really risen. So our agency has gone back to phase 2, which says that we are not doing any in-person visits at all. However, my rehab teaching staff and my orientation and mobility staff are stellar employees in that they have and continue to find creative ways to be able to still teach and still be able to provide stellar services as our agency does for the individuals that we serve. And as the sorry about that, as the director of the program, I get to hear about all of those things. And as I'm reviewing cases, I get to read about those things. And then when they need approvals, but our staff is certainly alive and well, and we're moving, of course. It's certainly not without its challenges. For example, I got a call of an individual as a referral that really needs somebody in their home, and unfortunately we can't get there. So I'm really hoping that the positivity rates will drop and we can go back into what we call phase 3, where we are doing in-person visits and can do that. But some of our teachers, while we can't go into homes, some of our teachers have gotten really creative with some of our individuals who can use things like FaceTime, and they've been able to work with somebody. They worked with somebody, had a teacher, person wanted to learn how to use their thermostat. And so they were able to, with FaceTime, to be able to use that. There's also, our teachers are resourceful. There is an app that is free to people who are blind or visually impaired called Be My Eyes. And so individuals are able to call into that and get somebody that can then help with visual tasks. And then, of course, there's also IRA, but it's a paid subscription and can be quite costly. But they do allow for 5-minute calls. I think you can do it once every 4 hours. You can do a 5-minute call, and sometimes that works really well, and sometimes the call goes longer. But in any case, our teachers and our O&M instructors are resourceful in that they're able to give them other resources to use as well. In terms of budget, we are hopeful that the General Assembly will give us some funding that they've projected. We still don't know, but right now we're being very judicious with the funding that we do have. I just submitted our 7OB report to RSA on our older blind individuals, and we had some really neat success stories where our teachers worked. A couple of them had some veterans that they were able to work with and made some real changes, and the veterans were really pleased. We had some of our other teachers that worked with some of our other individuals who are in their mid-80s that are able to read their mail and they're able to read recipes, and they're able to see pictures of their grandchildren because of the services that we have provided, and the magnification aids and things that we've been able to provide. So that's been really neat to get to read those success stories. Again, you know, COVID certainly has not been without its challenges, but as I said, we at DBVI have managed to make lemonade out of what could have perceived to be some really rotten lemons, but we're doing really, really well, and we have an administration that really does their very best to help our rehab teaching staff and independent living staff to be able to meet the challenges that come before us. And we're rocking along, and we just have a really great staff, and I'm just so proud to be a part of it. Any questions for me? I know I wasn't I didn't have as much, I guess, as Eric and Marcia shared, but I think you certainly have a really good idea of where we are and what we're doing.
Any questions for Judy? Thank you, Judy.
Okay, either I put y'all to sleep or
Not at all.
I'm still. Let's go over the SRC report for DARS. I think Lauren emailed you a copy of the minutes from the last meeting. That was one that I actually missed. And I was actually sitting here trying to remember why I missed it, but I can't remember, but I do apologize because I do want to make sure the silk is represented. You know, one thing about the DARS SRC, they are just as interested in being partners and connected to the silk. And, you know, that helps with having Lauren helping with the guidance of both of us. Something that Lauren is going to add in the newsletter coming up is the annual report that the SRC puts out. And when you get it, it's a 17-page PDF. And I'm going to do a spoiler. This is a spoiler alert because I'm going to give you, one thing that pops out for me reading this whole 17 pages. For years, we've been dealing with what's called the order of selection. And if you're familiar with that, it's almost something like Darwin would have come up with. But it's, in essence, a waiting list for services VR services. With COVID-19 and the slowdown of everything throughout DARS, they were able to, they realized some additional funding or some excess funding and were able to take care of all the clients that were on that waiting list. That hasn't happened since. And that's, I think that should be, if nothing else, as you said, making lemonade out of the lemons, that I think you can consider that a win. Anything else? I guess I looked for Lauren. Is there anything else that we need to share for the DARS SRC report?
I think that you got it. And like Sean said, I will make sure that you have a link in the next newsletter, which is next week. You'll start receiving that again. I know it's been a long hiatus. I'll make sure there's a link to that report.
Good deal. Well, any questions on the DARS SRC?
Don, I missed the win that you were talking about. Well, can you just go over that again?
We were basically able to take care of all of the clients that were on the waiting list. Waiting list building for 4.5 years, 5 years. So they were able to take care of a lot of needs. 1,613 clients to be exact.
That's awesome.
It is. Lauren, you want to go with the DBVI SRC report?
Sure. Ken, I'm gonna rely on you, but I want to tell you the most recent where I'm at with my understanding of the vacancy. Sean Soares from the Secretary of the Commonwealth's office contacted me and was under the assumption that Ken was already the representative and his term was coming up. But the last representative that you have actually had on the DBVI SRC was Raymond Kenny. So we are still working on getting this straightened out. I have asked Ken to find out what role he is serving in, and we need to make sure that if he cannot serve as the Silk representative, that we move forward with somebody else. So we're still in a holding pattern, and I do hope that it gets solved soon, and I'm working on it.
Well, okay. And that's pretty much it. We don't really know. There for a while, I was serving in various capacities, depending on the day of the week, it seemed like. But I need to talk to Sean because he and I have formed a pretty good bond, so I just need to straighten him out. Meanwhile, I think too, what we need to do is have you and Jessica Corlett or Maggie Mills and I get together to see what we can come up with on that also. Because I would rather have another person represent DBVI's SRC and just have me represent as a citizen, because that would give us more blind people, of course, which would, help the numbers. But as far as the report is concerned, I feel like Sean was giving my report because I missed the last SRC meeting and I sent in the written report. But I will say too that for a while, and Lauren knows this because Lauren and I both served on the DARS SRC at the same time. Serving on the DARS SRC and the DBVI SRC was very, very good for me because I got to see the differences and the similarities of both groups. And there's very little similarity, but now there's more because every year you have to fill out a statement for the governor's office, and the DBVI SRC would send in a one-page thing of this is who we are, this is what we did, blah, blah, blah. And Sean brought out the fact that this year it's 17 pages, and I've seen it as long as 25 pages. And one of the things I was able to do with the DBVI SRC was bring out pictures, which, those of us who are blind or vision impaired, we don't think a lot about pictures, but we now have photos in our report. We now have reports from each office in the agency. We have success stories. All of those things because I was able to see what the DARS SRC was doing and bring it over to DBVI. And I really think it's important that both of those groups have a representative back and forth, but I don't know that they do. So anyway, after this meeting, and I've got a few things coming up that are going to take up some time, but we need to, Lauren and I need to get with Sean and someone from DBVI, and let's see if we can't straighten it out as to who represents what.
Definitely.
Yep.
Any questions for Lauren or Ken? Okay, let's hear from Jerry. Jerry, are you still with us? Are you muted?
Jerry is on the Zoom, but his phone is muted. You might have to actually do a *6, Jerry.
John, this is Karen. If Jerry can't report, I can go ahead and do the VASIL report if you'd like me to.
Sure. Thank you. I see that Jerry's still muted. Okay.
You want me to go ahead?
Go ahead.
Okay. Well, as you know, others have said, SILs continue to determine the best way to continue services in the place that we find ourselves. So virtual services are becoming rather popular. Each SIL is doing something different based on the area that they're in and the staff that they have, as to whether staff are back in the office or still teleworking. So it's an interesting time for sure. I don't know how many of you knew David Barrett, who was the executive director of the Appalachian Independent Center. But right around, I think it was right around the first of the year, we were notified that David had passed away. So that's a real loss for independent living, not only in the Abingdon area, but all over the state of Virginia. So
Actually served on the Silk, didn't he?
I'm sorry?
He served on the Silk for a term.
Yeah, he was on the Silk also. So we are gearing up. Well, we've geared up for the General Assembly, which, you know, as Maureen said, is going to be a little bit different this time. I have gone ahead and sent Lauren the VASIL legislative priorities and also our budget amendments. We do have patrons for the budget amendments, so those are moving forward. As soon as we have the line item numbers, we'll go ahead and make sure that we share that with folks. But if there's anything that you can do as an individual, not as a representative of the Silk, in speaking with your legislators to help move those legislative priorities forward, we would certainly appreciate that. Several of the SILs are working with our consumers' personal attendants to try to get them vaccines just as quickly as we can. Each of the health departments around the Commonwealth are doing something a little bit different. So we've been trying to determine how best to make that happen. That basically came as a result of some advocacy work that VASIL did after the governor held this webinar regarding the vaccine and people with disabilities. So we We identified the personal attendants and the need for them to get vaccines, especially since a lot of them don't work just for one person. They work for, 2 or 3. So they're going from one consumer to the next consumer. So we were able to get them in the 1A priority. And now, like I said, some of us are working to get those vaccines for them as quickly as we can. We, again, our 704 report, same as what Lauren said, we were advised to hurry up and complete a 704 report and then hold it until we hear from ACL about how they want us to submit that report. We also are reviewing the JLARC study on special education, the report that came out. And we're going to be working with the General Assembly and agencies on some of those recommendations. We also submitted comment on the draft guidelines that were put out regarding the CIL's ability to use electronic records. I believe the comment period ends, I want to say the beginning of February, and then that should go into effect right around the 1st of February. And for a CIL that has one whole room dedicated to nothing but closed consumer service records, we're very excited to hear that electronic records are something that we're going to be able to do. Let me see, I got a text message from Jerry. Oh, he said he's pushed #6 and he's not muted on his end, but he's still showing up as muted here. And then they have a Verizon outage, so no phones or internet. So I don't know why he's still showing up muted.
*6.
*6, Jerry. Oh, try *6, Jerry, and maybe that will unmute you. Well, I don't know if Jerry has anything to add or not. I don't know if anybody has any questions for us. We do continue to use the CARES Act funding. We also had a report for those funds that were expended by the end of September. Again, the 6 federally funded CILs received CARES Act funding, and we figured out a way to share those funds with the other CILs so that people around the Commonwealth, people with disabilities, can benefit from those funds. And I think, oh, and just in time, Jerry's now figured out how to unmute himself. Jerry.
Is it working?
Yes.
Wow.
That was interesting. Do you have anything to add, Jerry?
Well, did you mention the letter to VDH?
Yes, I did. The advocacy that we did with the governor and VDH regarding getting vaccines to PAs.
Yeah, trying to really push. Yeah, and the only other thing is I've had a lot of contact with my board on this, and we're trying to be as loud of a voice on this rollout as possible. But it feels very haphazard, and I hesitate to be that blunt when I'm talking to the folks that are planning it. But there are a lot of multiple entry points in terms of accessing shots. There's disagreement on, and you kind of hinted at this, Karen, different localities are doing it different ways. But there doesn't even seem to be any uniformity across the state with how people with disabilities are prioritized. So here in Richmond, they were initially labeled 1C. So I've been really pushing back against that and trying to get people with disabilities to be higher up on the priority list. But there are folks entering the vaccine protocol portals in a number of different ways. And I'm pushing really strongly to say we don't have to have a single plan. You can have multiple points of entry. You can have entry points that are specific to a certain population. especially if we are behind in administering the shots, which just about everybody is right now. So let's do a good plan today rather than a perfect plan next week, because it's critical that we get moving on that.
This is Lauren. Ed Turner has asked in the chat, he says, I pay my own PA, would she qualify for the vaccine?
So Ed, this is Karen, and as Jerry said, it's really different all over the state. Now, our local health department reached out to us and said, would you be willing to coordinate the shots for personal attendants who are in the consumer directed program? And we did agree to do that. So we're gathering names and email addresses. You really need to look at the VDH website and go to the locality that you're in to see how to get people in the system to be able to, get an appointment. Jerry, I don't know if you have anything different in your area.
No, it's what I'm really concerned about is that folks who are well connected or have ongoing relationships with agencies are going to get all the latest information, and folks that aren't connected or are living independently and just kind of living life, they're going to miss out on some of this. So as much as possible, I think there's a lot of us that are just pushing people with disabilities onto folks' radar and saying, don't forget this population, and please enlist community providers and advocates in terms of identifying and pushing them towards you.
It looks like Debbie has a question.
Just want to add that our local health department actually sent me the link to give to people who are homebound, and that means they have no transportation to get to a vaccination spot, and they're in the waiver program, so they meet the level of care for nursing home, and they can fill it out themselves, but it's not to be published. And also the care attendants. And so I'm cautioned that this is going to be made more public if we just send it out to people, but I think that's what I'm getting a confirmation on that. But the care attendants are included in that 1A category.
This is Lauren again. I just want to make sure that you all know that in the chat, Eric has posted the link to the vaccination information with BDH. I recently registered on their new dashboard for the vaccination. That, from what I am being told, if you register for the vaccine, you could become eligible before your priority opens if there are excess vaccinations.
Right.
Yeah, you're right. It's already happened, Lauren.
Yeah. So, it is a little difficult, and I have been made aware that the dashboard application for that registry is not accessible.
Also in the chat, Maureen wanted Ed to know that his PA is in priority 1A, and so should be able to get the vaccine now.
Was that you?
Santha, this is Lauren again. She has put in the chat, not sure how IDDD population will get a proof of disability to get into the 1C category for vaccination. And I've heard a number of other people wondering how closely Virginia is following the CDC definitions and how to get more people vaccinated than just those limited definitions.
I don't know, is Marcia still on here? I don't think so.
I think that Marcia had to leave for the No Wrong Door
Yeah. One of the questions that's, we were wondering how DARS is going to get the vaccination to people who are in the CD program through DARS. I don't know if Charlotte or you know the answer to that.
I do not. Charlotte might.
I don't, but if you, Lauren, if you wanted to compile these questions, I'm sure we could direct them to either the appropriate folks in DARS or some folks at VDH who we might be able to get some response.
Sure, sure.
So,
Any other questions on the VASA? Anything else? That was a good conversation. Thank you, Karen and Jerry. Looking at the list, is Donald Garrett with us?
Donald Garrett has joined us.
Good afternoon.
And I have his presentation loaded into my PowerPoint, which you're seeing up. Donald, I apologize in advance. Some of your visual effects, just the blue stripe on the side did not carry over, but everything else is the same.
Oh, that's fine.
All right, and I've got your presentation started. Thank you so much for joining us today.
Sure, and thank you for having me. Good afternoon, everyone. My name is Donald Garrett, and I am a professional registered parliamentarian. And what does that mean? I love Robert's Rules of Order and making sure meetings are done great, properly, and in order and efficiently. And so today I'm going to present on parliamentary procedure and make sure you as the council have a great overview. My one ground rule is if you have any questions, please feel free to interrupt me, put it in the chat, speak it out loud, whatever you need to do to get your questions answered, especially since we're in this virtual environment. If we were in person, it'd be a little bit easier to see the non-verbal cues of someone slightly raising a hand if they have a question. So please just feel free to interrupt me. And so today, displayed on the screen are the kind of the various topics, the learning objectives of today's presentation. I'll be going over just an overview of what exactly parliamentary procedure is, what occurs at a meeting, what are the public meeting requirements and responsibilities. That's with the Virginia Freedom of Information Act. And what are the steps to handling a motion? And then at the end, I'll have some time for question and answer. But again, if you have questions during the presentation, please feel free to just go ahead and ask them. So what exactly is parliamentary procedure? And you can click next on that. And so it is defined, the definition kind of within Robert's Rules of Order is it's the name given to the tradition of rules and customs that have grown up in the civilized world for dealing with meeting problems. Essentially, the way I like to describe it is we always hear the term majority rules, but parliamentary procedure is how you get towards that majority rules. And so it bases itself kind of all the way back to the 15th century with the Parliament and the United Kingdom and everything, and all the way out in England. And those sort of principles have cycled through the various centuries to what we have today. And so it's really just about how do you get to that majority rules? How do you properly discuss the proposals and maybe make changes or send them to a group for further consideration before kind of getting to that penultimate vote of majority rules? And so click next. And so within parliamentary procedure, groups that use it, they're called deliberative assemblies. But again, that's just kind of, there's a wide range of those types of groups. And so when you have like a local assembly of an organized group, those are kind of like your anything you would think of as a membership organization. So parent-teacher associations or homeowners associations or interest groups. Then you also have your boards of directors. You guys as a council are kind of more like a statewide board in a way. Conventions, that's a lot for statewide and like national groups where that's a lot for a statewide and national groups where the individual local units will send a voting delegate to the nationwide convention. And so they use parliamentary procedure. And then also legislative bodies. So your city councils, your general assembly, they all use parliamentary procedure. And so the key word kind of here is these are deliberative. So these are assemblies that are meeting to vote on issues. And the group's vote as a whole is binding on the assembly. And so an example that might not be in a deliberative assembly is a workplace, right? Because ultimately your boss is the one who's got to kind of make the decision for the group, right? They might receive input, but the individual employees necessarily, their vote doesn't necessarily always matter depending on that boss's leadership style. But we're talking about groups where every person has a voice and then ultimately the group makes a decision. They're the ones that use parliamentary procedure. Next slide. So what exactly is Robert's Rules of Order? So sometimes the terms are interchanged, Robert's Rules, parliamentary procedure. But what Robert's Rules of Order is, it's called a parliamentary authority. And basically that's just a guidebook about, parliamentary procedure. And it was born in the 1800s, where the original author, General Robert, he had to lead a church meeting, and he wrote in his journal that meeting went by so horribly. So he was going to commit himself to studying parliamentary procedure and how to run a good meeting. And so for the next year, when he is tasked with running a church meeting, it'll go better. And so that was the first edition of Robert's Rules of Order. It was just a simple pamphlet that he used for himself to make sure his church meeting could be ran. But it became so popular that it became the most widely adopted book on the subject in North America. And so now it's in its 12th edition, starting all the way, I think it was in the year 1834. And so so Robert's Rules is a book on parliamentary procedure. There are other guides out there, but essentially Robert's Rules is the most popular one. You can click next. And so Robert's Rules as a parliamentary authority, it is not the only source of parliamentary procedure that groups have. And Robert's Rules itself recognizes that. And so what I have displayed on the slide is an order of precedence. And you'll see at the very, very top, you have your state, national, and local law. And so whenever you have requirements that the government has put down for your group, you always follow those first and foremost, right? And so as the state council, you have certain meeting requirements that you have to do with the Rehabilitation Act, right? That's a national law. And then as a state body, you have certain public meeting requirements with the Virginia Freedom of Information Act. And so when you have those, whatever those laws say supersede what's in Robert's Rules of Order. So you have your state national law, and then you have items like your bylaws, and then you get down to the kind of the parliamentary authority. And so kind of the main idea here is if you have a question, you kind of always want to start off with, okay, well, is it addressed in our bylaws, or is it addressed in the Rehabilitation Act? Okay, it's not in there. Then we'll go to Roberts and see what Roberts has to say. And then so at the very, very bottom, you'll see custom/practice. That's basically you're just doing things. That's just how we've always done things, right? And so remember, it's at the very bottom. So if how you've always done things is in conflict with something that's higher on the list, you just stop doing it that way and make sure you're doing it the proper way, which is what was asked for by something that was higher on the list. And so on the next slide, I have an example of how this kind of plays out. And so this situation, I came up with this quickly for something that this group might encounter. So the question might be, well, how many days of notice do we as the council have to give for our upcoming meeting? We want to make sure we get input on our draft for the state plan. And so can you click? So you might do a little bit of research. Oh, well, the bylaws just say we have to make sure the meetings are open and we give sufficient advance notice. Well, okay, well, that was just the bylaws. What else is there? So next. Oh, well, Virginia FOIA said at least 3 working days. Oh, okay. What else is there? Next. Roberts just said, oh, this has to make sure you notice if your meeting has a reasonable time in advance. Okay, so we have reasonable, sufficient, 3 working days. Then one more click. But our federal regulations say that if we're getting comment on our draft plan, we have to give at least 30 days notice. So out of these 4 sorts of sources you have for the rules for that meeting, the last one right there, the federal regulation, is going to super trump everything else. And so this is just an example to show how how you would approach what your meeting requirements are, kind of based off of varying different sources of documents. So does anyone have any questions about that? Okay, yeah, so I guess again, the main point is always kind of follow your legal requirements first, and then if you have a question or if it's not addressed in the legal requirements, that's when you can kind of look towards Robert's Rules of Order. Okay, next slide. Yeah. So what is a meeting? And so at the baseline definition of a meeting is just the event of being assembled to transact business. And so typically you need to make sure the members, the people who are part of your group, they're given notice of the meeting, right? People have to know when and where they have to show up to be able to vote and make that group decision. And in order for the meeting to be valid, you have to have a quorum. And a quorum is just the minimum number of people that have to be present for the meeting to be valid. And so if I remember correctly, I think for your council bylaws, it was a majority. Typically, it's a majority of the membership, but typically it's a majority of the membership, but sometimes for very, very large groups, it might be a little bit smaller than that. And typically at a meeting, you have a chairperson or a president. They're the person that's kind of leading the meeting. They are picking on who's next to speak, and then you always have someone who's responsible for taking the minutes. And so I see something in the chat from Eric, but I'm actually addressing that right on the next slide for you. So this is the definition for meeting. That was the definition for meetings under Robert's Rules of Order. But because you all are because you guys are a state body, a body of the state of Virginia, you have additional requirements under the Freedom of Information Act for what exactly constitutes a meeting. And so with the Freedom of Information Act, the whole idea is the tax-paying public should have the right to understand how their dollars or tax dollars are being used. And so it requires some open meetings of council meetings like this, so people can essentially see the business of the state being carried out. And so under the Freedom of Information Act, they actually use a much more broader definition for what a meeting is. And essentially, like if for it to be a meeting under the Virginia FOIA, it has to, if three of you are assembled together to talk about an issue within your purview, that constitutes a meeting under FOIA, and you have to follow all the steps to make sure it's a properly called meeting. And so so like the definition is here on the slide. So it says, even if it's just an informal assemblage of only three of you, it's still a meeting under FOIA, and the public has a right to know that the three of you are at least gathering in a room to talk about the issues. And it's important because in addition to FOIA, like Eric had typed into the chat, not only do you have to give notice to the members of the council that a meeting is going to occur, you also have to give notice to the general public that the meeting is going to occur, so they can witness you having these discussions on these issues. And so that's a particular piece when you are a public body. And it's important because with Virginia FOIA, you can votes are only valid if they occur at a properly called public meeting. And so I think the main difference between this slide and the previous slide is for this slide, even if you don't have a quorum of the council together to make a valid decision, and it's only three of you who are having sort of an informal discussion about a topic that's under your purview, you still have to follow the public announcement procedures to let the people still witness you having that small discussion. Okay, next slide. So types of meetings. There are a few types of meetings. The first one is just your regular meeting. And there's no other way to describe it other than it's just the periodic business meetings of an organization. And so so a lot of the times you'll hear the term kind of thrown around, an annual meeting. And so with the definition of regular meetings, because it's periodic, each group is different. Some groups only meet once a year just to elect a board, and then the board meets throughout the year to take care of the organization's affairs. Other organizations like this one, they might meet quarterly, right? So regular meetings are just those regularly occurring business meetings on whatever schedule you have that meets your group's needs. Next, we have special meetings, and those are going to be separate sessions outside of those regularly scheduled meetings. And what's special about special meetings is that when you give notice that you're having a special meeting, the only items of business that you can consider at a special meeting are those items that you had said in that notice. And so that is to that is to I guess that is to protect the rights of absent people, because since this is a specially called meeting, and if I join an organization and I'm under the impression we're only going to meet quarterly and we have to have a special meeting, I need to know the topic, right? So if it's not a big deal and I end up like not showing up, then that's fine, because I allowed everyone else to go, and I allowed everyone else to meet and do that special item of business. And so the whole idea of special meetings is, if you're going to go outside kind of your regular schedule, people need to know, why is it so special? And you can only do those things that you called, the reasons why you called that meeting. And next we have what's called an adjourned or continued meeting. But essentially that is just a continuation of a current meeting. It's called an adjourned meeting or a continued meeting, and a lot of the times this happens if you call a meeting of your group and you don't have a quorum, so any decision that you make would not be valid. And so the people that are still there at that meeting can reschedule the current meeting, and then hopefully you'll get enough people to attend the rescheduled meeting, and the continued meeting is just picking up from the meeting that you had to cancel because there weren't enough people there. And so, yeah, so those are basically kind of like your three types of meetings there. If you click next, I think there might be one more bullet. No, yeah. So at any meeting with Robert's Rules of Order, and this is even if you don't, like a lot of the times you have an agenda, you stick to your agenda, but if you don't have an agenda or you have no idea where to start, what we have on the screen is called the standard order of business. And so this is just the recommended flow of an individual meeting under Robert's Rules of Order that you can just rely on if you either don't have an agenda or you're not quite sure where to start. And so typically at the start of a meeting, you approve the meeting minutes of the previous meeting. And so minutes are just a record of what had occurred at a meeting. And so the group is just taking a vote to formally adopt it to say, yeah, this is our record. And then you kind of do that at the start of the meeting. Next, after the meeting minutes is when you get to your officer and committee reports. This portion of the meeting is really used for when officers and committees, they either report on their activities or if they want to propose an item of business that needs the entire group's approval, they'll bring it up during this portion because the committee might not have authorization. The committee might not have the authorization to act on behalf of the organization, but they can make a recommendation that then the organization can then adopt. So that is all during that reports section. And then after that, you have special committee reports. And the only difference between a special and a standing committee is that with special committees, once they do their final report, they're disbanded. Whereas standing committees, they kind of last. They have a continuous existence, regardless of how often or when they report. Next, you have special orders, and essentially the most important ones are the sorts of things that are in your bylaws. And so, for example, I think for this council's bylaws, it stated that at the Q4 meeting, you schedule out the meetings for the next year, right? And so at the Q4 meeting, it would be a special order at that meeting to make sure you do the meeting schedule for the next year. And so special orders are those sort of things that have to occur at a particular meeting. After that, you have unfinished business, which is just things that were either postponed from the previous meeting or things you just did not get to at the last meeting. And then finally, you have a new business, which is basically anything that does not fit one of the previous categories. And so again, with new business, every group has different norms that they follow. Some groups want things to be vetted by a committee before it comes up under new business. But so that's always just kind of like a group to group a norm that you might have. But if you ever need a mnemonic device to remember what the order of a meeting can be, I use Mrs. Sun, MRSSUN, for each of the headers that we just went over. Were there any questions about that?
I don't have a question, but I'm enjoying listening to this.
Great. I forgot to say on the opening slide, my main goal is if everyone learns at least one new thing today, I did my job. So I want everyone to try to take away at least one new thing. And so earlier I had kind of previewed that since you guys are funded with taxpayer dollars, you also are subject to the Virginia Freedom of Information Act, or FOIA, FOIA. And so a lot of the times this deals with the public records, but there's also meeting requirements. And so on this slide, I kind of picked out the 6 or 7 most important ones but always kind of interface with staff, or the staff interface with the attorneys and whatnot to make sure if you have any particular questions about what's specific, how it specifically applies. But right here, I'm just kind of going over the top 5 or 6 or so. And so as a public meeting, the first requirement is, again, the public has to know about when you're meeting. And so they have to be given notice. Erica typed in the chat that there's a Commonwealth calendar where the meeting information is posted. And this group also does a really good job at maintaining its website that has all the agendas and packets and everything, and the minutes and everything. And so it's important that the public not only know when the meeting's happening, but they also have a copy of the agenda packets, what you're going to consider at that meeting. Next. And so with it, not only can the public have to know when the meeting is going to occur, the meetings also have to be open to them to witness. And so the public also has the right to record what's being said at the meeting. And so when you're doing this public business, if it's try to remember that anything you say could end up on YouTube one day. And so always just kind of keep that in mind, because you are a steward of the taxpayers. And so you are, not only can the public witness your meeting, they can also record it as well. Next. So something that's particular in the age of COVID, when you're meeting in this electronic format, the law is, it wants you to do audible roll call votes, just so it can be placed in the minutes and in the records about how, if you take a vote on something, how the vote occurred. Because when you're meeting in person, and if you're taking a vote by raising your hand, it's really easy to verify and discount the number of hands that were raised. But if someone's participating over the phone or over Zoom and their camera is not turned on and whatnot, it's just always, you need to take the vote by this audible way, so that everyone in the public can know how you voted. Because if you're on the phone, necessarily they can't see you raise your hand at a meeting. Next. No secret or written ballots. And so that is important both for in-person meetings and electronic Zoom meetings. And so so that means you can't use the Zoom polling feature to take a vote on something, or you can't kind of email your vote in to the staff member on a matter. It has to be it can't be secret, and it can't be kind of written. And so again, it's all about just making sure you're doing your business out in the public, for the public sphere to see how you voted on a particular matter. Next. And so, like I said earlier, meetings have to be open to the public. You as a council, you are allowed to close certain portions of your meetings, but that's mainly just to discuss certain sensitive matters. And those exceptions are written into the law. And the primary ones are for like employment, like human resources matters. If you're hiring, disciplining, or firing someone, you can close the portion of the meeting, so that's not in the public record. Or if you're getting advice from legal counsel, you don't want that to kind of be in the public record. So there are certain limited reasons why you can't have a closed a meeting. But again, when you are closing the meeting, you have to take a vote on closing the meeting, and you have to give the reasons for why you're closing the meeting. And then after you have the closed portion of the meeting, you reopen it to an open meeting, and you do a certification that we only discussed those previously identified things in the closed portion of the meeting. So there's a little procedure behind that, but again, those are kind of limited in scope. And finally, so if you go into a closed session, that's really only for discussion purposes. All your votes that you take, they need to be taken during an open meeting to be valid. And so, so even if you have kind of like your heated discussion during your closed meeting, you can, when you are taking your vote on the discussion that you had, you just need to reasonably identify for the public what it is. And so I think, for example, if you were getting legal advice on a contract, like for example, right? When you vote on it in the open meeting, you might just use like a vendor A, like a pseudonym, a pen name to refer to a particular vendor instead of the specific company's name. But it's at least like out in the public that you took a vote on approving that contract, but the actual company's name might need to be redacted from the minutes, if that makes sense. So this is just kind of like that was just the six kind of meeting requirements with FOIA. Were there any questions about that? Okay, jumping around a little bit. So my purpose for kind of going over what meetings were at first is because that's a really good, it's kind of like foundation about kind of like why you're here and why you use parliamentary procedure and why you kind of have to kind of follow these FOIA regulations and everything. And so now I'm going to talk about and the structure for a meeting. So now I'm going to talk about how you actually propose items of business and handle it and consider it and vote on it at a meeting. And so under parliamentary procedure, you use a, go back one slide.
Sorry.
Oh,
Sometimes this happens when I'm trying to look at the chat. I apologize. There you go.
Perfect. So under parliamentary procedure, you bring an item of business through what's called a motion. And so the main motion is just a proposal that the organization take action on something. You can almost say a motion is just a proposal, and but we say a motion or I move to do something because that's what they did back in the 15th century. And so that's just the vocabulary that we continue to use to this day. You could almost say I propose that we do something, but for parliamentary procedure, we say I move to do something. And so the form of making that proposal is I move to, or I move that. So I move to approve that contract, or I move that the building be closed for repair. And it's really important that your motions, you make them in the positive, right? And so what you don't say is, oh, I move that we don't do something, because then like that confuses the voting, because is a no vote to not doing something the same as a yes vote? And so that's why you always want to make your motion in a way to where yes means I support doing an action and no means I do not support doing an action. Next slide. Okay, so there's 6 steps to handling a motion. And the first step is just making the motion, right? And so again, this kind of all depends on the context of your meeting. If you're all in the same room, right, it's a little bit easier to kind of raise your hand and the chairperson points on you to speak, and then you make your motion, right? And so just however you normally get the recognition from the meeting's chairperson, you'll do it that way, and then you'll just state your motion. So I move to approve, I don't know. Yeah, I move to approve X, right? So the next step number 2, is the chair asks if there is a second to the motion. And so that can be as formal as someone saying, Mr. Chairperson, I second that motion. or you can just blurt out second. And the whole idea behind that is just to weed out proposals that only have one supporter. So, but when you are seconding something, that doesn't necessarily mean that you are in favor of it. That just means you think it deserves discussion and further discussion and then a vote on it. And so, but if you can't even, Robert says if you can't even get someone else to at least agree that that's something that should be discussed, that's probably not that's probably not worth the group's time to devote in the meeting to discussing that motion. So step one is someone makes a motion, and step two is someone seconds it. Next. One more. 3. So then the meeting chair restates the motion, right? So the chairperson, the president would say, well, it's been moved and seconded to approve the contract, right? And so this is really important because if a motion is not, if the motion is kind of worded ambiguously, the chair can kind of help the person reframe it just to make sure everyone's on the same page. And this is important because the next step after this is you are debating the motion. And so when the chair kind of restates the motion, that is opening up the stage and setting the parameters for the debate. And so during the debate phase, you can only discuss the current item, the current pending item of business, which is that motion. And so by the chair restating it, that is making sure everyone's on the same page. And so this is also kind of like the phase to where if someone makes a motion and it might be against your bylaws or something like that, this is where the chair would state that the motion is not in order, and then it wouldn't go to the debate phase. But the next step, I kind of already talked about it, but again, that is the whole the debate portion. And so debate has to be relevant and only to and you can only talk about the currently pending motion. And ideally, it's great to try to alternate between people who are in favor and people who are against. If the chairperson does not know that they're the ones who calls on who's to speak next, if they don't know who might be against something, that they can just ask. Well, for example, by saying, well, we've heard a lot of speakers speak in favor of this. Is there anyone who wants to provide an opposing view, right? And again, everyone needs to be respectful during the debate. Debate the idea, not the personalities. And so ideally, the chairperson needs to make sure everyone can speaks once before someone else speaks a second time. And also during this debate phase is where you can propose what's called a secondary motion, and I cover that in a couple of slides. But that's basically, those are procedural motions that that aren't items of business themselves, but they affect the current motion, and I'll go over that. But that all kind of happens like during the debate phase. And the next slide. And then so kind of once the discussion has come to a close, the chairperson is going to state the motion one more time, because, and that's really important because again, that is the wording of which people have freshest in their mind right before they vote on it, right? And so as I'll cover on the next slide, after a motion has been made, someone else can make another motion to change the wording of it, right? So they might amend the document or amend the text of something. And so if any of the wording has been changed, the chair restating the motion one more time before a vote is important, so that people are aware that, okay, this is the version that I am voting on that incorporates any changes that we have made. Next one. And finally, the last step is just actually voting on the motion. And since we're kind of in this COVID environment, for any of those official items of business, you kind of want to go down the list of people and ask if the vote yes or no, tally it up, and then announce. Well, there was 8 yeses and 2 nos, so the motion passes, right? When you sometimes people might ask, like, how do you calculate a majority vote? A majority just means more than half, and so yeah, this more than half the votes counted. And so if it was 5 yes votes and 5 no votes, that motion would fail because 5 is not more than half. 5 is half of 10. And so that's why you need to have 6 and 4, not 5 and 5. So that's just an example. So majority means more than half. So next slide, we're almost through. So earlier I kind of talked about secondary motions, and secondary motions, I like to call them procedural motions. And so they themselves are not items of business, but they alter items of business. And so I have here about 4 examples of them. Robert's Rules of Order has a whole, the book goes on and on about all the different types of secondary motions, but there's about 4 or 5 like main ones that people should know about. So the first one is the motion to amend. And so like a lot of the time, someone will propose a statement or a resolution or like a document, and you really think the text of it could be improved. So during the debate phase, you would get recognition from the chair and propose your change by saying, well, I move to amend this document by, and then describing the amendment. So the amendment might be by striking out that last paragraph, or by striking out 15 and inserting 17. Little things like that. And then, so once someone makes that motion to amend, then you follow the motion steps all over again, and you debate just the amendment. And then depending on if the amendments vote up or down, then you go back to the main motion. And so I'll show you what that looks like on the next slide. But the next secondary motion is if you want to send something to a committee, that's called a motion to refer. And so again, you're just during the debate phase, if the debate is dragging out for a very long time and you think a smaller group might be able to hash out the differences and then give a recommendation to the entire group, you could just move to refer it to a committee. So you can it could be a named committee, or it could be like a special committee consisting of the people that you might name to it. Next. So postpone, this is also if the group needs a little bit more time to kind of sit and think about and think about the motion before making a decision on it, you can postpone it. But with the motion to postpone, you can't postpone it any later than your next quarterly meeting. And so so you can postpone it within the meeting, right? So if you need more time, you want to vote on it in about an hour, that's fine, but it can't go beyond the next meeting. And so once you arrive at the next meeting, that's when it becomes unfinished business. And next, and finally, the other important secondary motion is anything dealing with debate. And so sometimes debate has gone on for a very, very long time and you just want to wrap up. And so with a 2/3 vote, you can either move to just stop debate and let's vote on it now, or you can say, we only want to debate for 5 more minutes, or at the beginning of something, you might say, well, I'm going to limit debate to 1 minute per speech. Just, you can be as creative as you want with it, but anytime you're kind of adding these parameters to debate, it takes a 2/3 vote because it impacts someone's right to discuss the issues. And so, yeah, again, these 4 during the debate phase of a motion is when you would make them. And so on the next slide, This is a little example. So click once. So let's say at our meeting where we have the main motion is I move to hold a potluck. And so right now, then you're discussing about the potluck. And then kind of during the discussion, people are kind of going back and forth. Well, what date is the best date to have the potluck and whatnot? So someone else during the debate phase will make a motion to amend the motion by adding in the words in March. And so the idea behind that is to make the potluck motion more clear that you're going to hold your potluck in March instead of just this broad statement about holding a potluck. And then then kind of during your debate, you're talking about, well, is March really the best date? And well, what room are we going to have it in? And are we going to have, are the COVID vaccines, is it going to be safe? Should the potluck be catered? So next slide. Or so someone says, you know what, there's a lot of many details that need to be worked out before we as a group are ready to decide on holding this potluck. So I'm going to move to send this motion to the events committee, right? And so this is that next secondary motion to where the events committee would then meet, and then they would come back at the next meeting with their recommendations for what's the best way forward. What is their recommendation for getting this potluck accomplished? And so you kind of have these three motions pending now. And so, but the key is you vote on them in reverse order from which they were made. So think of it as if you had three plates stacked on each other. The bottom plate, the first plate is the motion have a potluck. The second plate is adding the potluck in March. And then the third plate is sending it to the events committee. So you can't take the bottom plate and vote on the bottom plate because then the other two will come crashing down. So you have to start with the plate that's on top. And then so next, so the first thing you vote and have a discussion on is whether or not to send the item of business to the events committee. If this motion passes, then the committee gets it, and then the discussion's over. You go on to the next thing. However, if that motion fails, next slide, that's when you go back to just discussing the amendment. And so now you're only discussing whether or not you're going to do it the potluck in March, whether they're not going to do the potluck in March. So if that motion is voted yes, then your potluck motion is amended, and then you vote on the potluck motion as amended. However, if that motion to amend is voted no, then you just get back to the main motion, which is just the potluck as a whole. And so I think the one important thing from this slide is even if you kind of have those procedural motions or secondary motions made during the meeting, you always want to make sure that you're still taking the final vote on the main motion because especially for the record purposes, because people might have voted for the amendments and whatnot, but you still need to have the final vote on whatever that final product is. So were there any questions about this?
Donald, this is great. I really appreciate it and all the detail. So, and I just want to piggyback off of what Alexis said. Just this is so educational.
Good. Good. Well, let's see. I think I only have like one more slide left. And so this is this resources for further study. On the right-hand side, there's a photo of a book called Robert's Rules of Order, newly revised in brief. And it's about maybe like 100 pages or so, but it's a fairly quick read, and that will just go over like all the basics for you. It's designed for you to be able to just kind of thumb through it and be once you're done reading, have a baseline understanding of kind of all the basic concepts I just went over. If you want to quiz yourself, the National Association of Parliamentarians actually has a basic membership exam that is based off of that book. And so it's a great way. It's about 100 questions. And so it's a great way if you want to kind of test yourself on what you read or what you had studied You can get that from the NAP. And then a little shameless plug for my website, lastminutemeetings.net. I do blog posts every once in a while about different emotions and whatnot, and meetings and updates and everything. And so maybe about every other month or so, I might do like a post. And so, you know, if you randomly check out my website, you might see a topic there that might interest you. But that is what I had for today's learning and everything. And so we have about 10 minutes or so. If anyone has any sort of questions or a hypothetical situation that they want an answer on, I am here to answer that question.
Donald, thank you for the education. I just sitting here watching through this, wishing that I'd have known a lot of this a couple years ago when I took over chairman here. Anybody on the committee have questions for Donald? No. Okay. Well, Donald, thank you. Or okay, Ken.
Yeah, I do have a question actually, but it's not for Donald. I was going to ask Lauren if she's got a copy of this presentation, these slides, that if she could share them with us, because it never hurts to stay brushed up on all this stuff. And I belong to about 3 fraternal organizations that use Robert's rules, and I can sure use the help once in a while.
Donald, is it okay if I share your PowerPoint?
Yes, it is. This is a public meeting, so you share it with him, share it with the public. It is all good.
Thank you so much. This
Thank
is
you.
so helpful. And I just have to say, Donald has really been a pleasure to work with, and just so easygoing in arranging you guys having this session. So I thank you too.
Oh, and thank you for having me. No, this is great. Like I said, I love meetings and Roberts, and so it's really always great when I have an opportunity to kind of share this with other groups and everything.
Good deal. Well, if there are no other questions for Donald, I guess I would look to Lauren to see if you need any guidance on the achievements and barriers that are on the agenda item.
I don't believe so. I think that we have quite a few barriers to report just based on the VASL report. So that's what I would like to use for some of the barriers, as well as some of the other agency and special report updates. And that is also where we have many successes to report. So I think that I am good unless anybody would like to offer something specific to me now.
Any comments or thoughts?
Oh, I know a barrier. We discussed it the other day, Lauren, and that's the FOIA information page that ethics committee has. And in fact, DBVI is having to redo it for people who are blind and visually impaired because they won't do it.
Are you talking about the conflict of interest training?
Yeah.
Okay, yeah, and that is also not captioned. So that has been brought to their attention a few times, but that is definitely a good barrier to report.
Every year, and they don't care.
Well, I hate to presume that. I'm going to keep trying to help them be aware that they are not accessible.
That's good. A good way to put it.
Yeah, no, they don't care.
Gary'd like to say something.
Barriers.
Yeah, Lauren, I told you that wasn't captioned. And it was a barrier for me. You sent me to a different site, and that was captioned.
Yes, I have a couple of different resources in my sleeves, and I have to alternate them accordingly. And thank goodness we do have alternate solutions, but really the FOIA site should have captioning.
I agree. Any other barriers to throw out? Okay. Well, it is 7 minutes before 2 o'clock, and I am going to sign off as chair and welcome Karen for the next meeting. It's been a pleasure being the helping to lead these sessions for the last couple of years, and thank you for allowing me that. Is there a motion to adjourn?
Motion to adjourn the meeting.
Okay, Rob, is there a second?
Second.
All right, Gary. All those in favor, vote by signing off. Thank you all.
Yeah, I'm not gonna, you don't need a roll call for that. There's no further business.
Thank you. Take care.
Thank you all so much.
Hey, Charlotte, can you hang on for a second?
Yes. I'm going to stop the live stream though.
Okay.